you. I actually remember where I got it from, but I know I got a really good deal on it.
Oh, wow.
Yeah.
Hi, I'm Mishita.
And I'm Drasthi.
Nice to meet you.
You too.
So, why are you here?
Okay, so 2 weeks ago, I actually hurt my shoulder really bad while playing badminton, and now it's been hurting me ever since.
Same. I messed up my shoulder playing baseball.
Mishita, Drasthi, the exercise room is ready for you. Mark will be there shortly.
Thank you. I think you're doing it wrong. I think you're supposed to do that. I think you're supposed to use, do this exercise.
No, I think you're wrong, because Mark told me that if I injured my shoulder, I needed to use the dumbbells, not the yoga ball.
You're messing your shoulder up. You're not supposed to do this.
What are you talking about? You're messing up your shoulder by doing that.
You know what? Let's solve this with Mark.
Fine.
Yeah, okay. Mark!
Hello, ladies. What can I help you with today?
Okay, look. She's saying that you're supposed to use the dumbbells for the shoulder exercise, not the yoga ball. I think she's wrong.
What are you talking about? Mark, you clearly told me that if I wanted to rebuild my shoulder muscles, I should be using the dumbbells.
Okay, Mark.
Ladies, I think there's a bit of a confusion. Although both of you injured your shoulders, you hurt different parts of it.
Huh?
To clear up this confusion, let me call Lucy. Lucy!
Hello, ladies.
Hi.
Hi. So today I'm going to be telling you about the most important joint in our body, the shoulder joint.
The shoulder joint, glenohumeral joint, is a ball and socket joint, which is a special case of synovial joint that experiences the highest freedom of motion in the body. It is a major joint between the scapula and the humerus. The maneuverability of this joint allows it to be multi-axial due to the need for great motion and vast amount of musculature needed to move and support the shoulder.
This joint is formed by the articulation of the head of the humerus with the glenoid fossa cavity of the scapula. Both articulating surfaces are lined with hyaline cartilage, common for a synovial type joint. The glenoid labrum is a fibrocartilage rim surrounding the margin of the glenoid fossa used to add depth and lower the disproportion in surfaces. As such, to give the joint stability, the head of the humerus is larger than the glenoid fossa.
A fibrous sheath that bounds the structures of the joint is called a joint capsule. It stretches from the anatomical neck of the humerus to the border of the glenoid fossa. To lessen the friction between the articular surfaces of the glenoid fossa and the humerus, synovial fluid is produced by the synovial membrane that lines the inner surface of the joint capsule. Furthermore, to reduce the friction in the joint, many synovial bursae are located at points of friction between tendons and other joint structures. It acts like a lubricated cushion wedged between two surfaces.
The articular capsule, which completely surrounds the cavity, is reinforced by several ligaments, including the coracohumeral ligament and the glenohumeral ligament. The glenohumeral ligaments, superior, middle, and inferior, are connective tissues that connect bone to provide stability. The humerus is attached to the glenoid fossa by these ligaments, which stabilizes the shoulder, preventing it from dislocating anteriorly. As well, the coracohumeral ligament is a connective tissue that supports the superior part of the joint capsule by attaching the base of the coracoid process to the humerus through the greater tubercle.
As a ball and socket synovial joint, there is a wide range of movement associated with the glenohumeral joint. In the sagittal plane, abduction is produced by the upward lateral movement of the humerus out to the side away from the body, while adduction occurs due to the downward medial movement of the humerus towards the body. In the frontal plane, flexion at this joint occurs by the movement of the humerus straight anteriorly, while the movement of the humerus straight posteriorly produces extension. External rotation is created by the lateral movement of the humerus around its long axis away from the midline of the body, so that the thumb is pointing laterally. Wherefore, internal rotation is the medial movement of the humerus around its long axis towards the midline, so that the thumb is pointing medially. Circumduction also occurs at this joint by the conical movement of the humerus around its long axis.
The glenoid labrum is the cup-shaped rim of cartilage that lines and reinforces the ball and socket joint of the shoulder. The labrum is the attachment site for the ligaments and supports the ball and socket joint along with the rotator cuff, tendons, and muscles. It contributes to shoulder stability and when torn can lead to partial or complete shoulder dislocation. However, much superior movement of the humeral head is prevented by the coracoacromial arch. The anterior dislocation is a result of hyperextension and lateral rotation of the humerus. The head of the humerus is forced into the weakest part of the joint capsule, both anteriorly and posteriorly. This tearing of the capsule is associated with a greater risk of future dislocations. During the dislocation, the axillary nerve that runs in close proximity to the joint and around the neck of the humerus can be damaged. This injury to the nerve can result in paralysis of the deltoid and loss of sensation over that area.
A tendon is a cord that connects muscle to bone. Most tendinitis is a result of inflammation in the tendon. The most commonly affected tendons in the shoulder are the 4 rotator cuff tendons and one of the bicep tendons. The rotator cuff is made up of 4 small muscles that come off of the scapula and attach to the top of the humerus. These muscles help to add the ball of the humerus into the socket of the scapula. They provide stability to the shoulder and act to rotate the arm. Repetitive overhead activities can cause the rotator cuff muscles to fray due to the repeated rubbing on the bone. As the muscle begins to fray, they respond to the injury by becoming inflamed and painful. With continued fraying, the muscle may eventually tear.
The bone landmarks that can be utilized to locate the glenohumeral joint is the anterior portion of the acromion process. When palpated distal to this landmark with the arm internally rotated, the greater tubercle of the humerus, which serves as an attachment point for rotator cuff muscles, will be felt. Tenderness in this area can indicate pathology of rotator cuff muscles.
So now to understand, since the injuries are different, the treatment they receive will also be different.
Yeah, I guess so.
Yeah, I do too. But you're still wrong.
No, you're wrong.